The acne and or tendency to gain weight or having to work harder to keep that balance is one thing, and that's frustrating, but there are ramifications that have to do with bone health and cardiovascular health and brain health over the woman's whole life, even when she's in menopause.
Welcome to the Healthy Skin Show with Jennifer Fugo, where we're flipping everything you've been told about your chronic skin issues upside down and connecting you with alternative solutions your dermatologist never told you about.
Welcome back, everybody, to episode number 13 of the Healthy Skin Show. Today, we are going to talk about adult acne and one of the hidden root causes that underlies the acne that you're like, didn't I get past this whole puberty teenager stage where I had acne? Why is it back? We're going to talk about that today. But first, I want to answer a listener's question. This one really jumped out at me, and it's something that is a bit of a pet peeve for me because there's a lot of misinformation out there about what certain diets can and cannot do. And so this question comes today from Jane. Let's take a listen.
Hi, Jennifer. I'm so excited to hear your podcast. Thanks for being a resource. So my question is related to rosacea. I have a bit of overall facial redness, and one of my cheeks in particular has what I believe to be rosacea. It kind of looks like subsurface acne, and I've had it for about a year. It just doesn't go away, and it's only on one cheek. I eat a paleo-type diet, pretty much gluten-free, dairy-free, drink bone broth, eat liver, homemade ferments, and I do have a sweet tooth and eat chocolate on occasion. As far as products, I oil cleanse, use CeraVe lotion, wear zinc sunscreen, and occasionally I'll wear 100% pure makeup. So I think I'm doing pretty good. I've considered doing AIP, the Elimination and Reintroduction Diet, but it's quite a commitment, and correct me if I'm wrong, I think the idea is to see improvement of the symptoms before starting introductions. So I could be on it forever. My question is two parts. One, would you recommend doing the AIP? Have you seen it help with rosacea? And two, what approach would you take with rosacea? Can you recommend a few steps I can work through to discover the cause, find relief? Thank you so much.
First of all, Jane, I just want to say thank you so much for submitting a question. And this was a good one. I will say this. There are times when people will go above and beyond, and it sounds like you have gone above and beyond and you're doing all of these things that seem right, that should correct the issue, and they're just not. And so it makes sense that you're wondering why food and diet and all these changes aren't enough, and maybe you should take that next step, try AIP, and see if it works. And I get it. AIP is a huge commitment. That said, there are things that food and diet changes alone cannot fix. And I think that's a really important message that many people out there have failed to hear. And seeing so many diet protocols out there, they assume that, and we all assume, I get it, I came from this idea that food is medicine, and it certainly is. But there are certain conditions and issues that food cannot fix. It cannot fix dysbiosis. It cannot fix gut infections. It cannot fix liver detoxification challenges. And in those instances, it's better to dig for the root cause than throw a dart in the dark while you're blindfolded, hoping that you might, just might, hit the bullseye. And so with that said, you know, you've done a lot of outside work, and I know that the inside work that you've done is diet-based. What I would say is, number one, you need to look for the root cause. You need to focus your energy in that particular arena rather than guessing, because that's what you've done, is a lot of guessing. And it's good guesses. You've done a lot of great work, and I don't want you to feel defeated in any way, shape, or form. But it's time to say, hey, I actually need some help. And so what that looks like is likely getting some gut testing done to figure out what's going on. You can do that in a number of different ways. There's different stool panels out there that are more functionally based that provide you a lot of information about the microbiome, inflammation within the gut, and other factors that impact your body's ability to absorb the food that you eat. Because I know everybody says you are what you eat, But in reality, we are what we absorb. Now, here's the other piece. The one thing you didn't mention, and I could be completely off here, but it sounds like you might not have actually gone to find out what is going on with your skin. Well, many of us have had some difficult and trying encounters with dermatologists and doctors who don't really listen, who just want to eyeball every single condition. It's best not to assume what is going on with your skin. It'd be better if you went, asked for a biopsy, get some testing done, and find out what's really going on underneath the surface, because you might spend a lot of time and energy trying to address what you think is rosacea, and it might not be rosacea. And so the approach to address that might be quite different. Now, here's the thing. For those of you who have been wondering about AIP, I think it's worthwhile to mention this. I am very good friends with Mickey Trescott. Some of you who listened to the Eczema and Psoriasis Awareness Week heard me talk to Mickey extensively about the use of AIP in trying to address chronic, typically autoimmune issues. So it's called the autoimmune protocol. Rosacea is not autoimmune. Rosacea tends to be triggered by inflammation that's going on underneath the surface, and two big triggers for that are Candida and or SIBO. And those are things that food cannot fix. They are things that have to be identified through testing, and you're going to need to do a protocol under the guidance of a practitioner to really address those particular issues. So in that case, I don't think AIP would be worth it to you unless you really feel gung-ho about it. Frankly, if this has been going on for that long, and if you're really dedicated to getting rid of it, I'd say put your energy into figuring out what's going on underneath the surface. Check out the Skin Labs testing article that we have here on skinterrupt.com. And we also have a really great handout as well that has functional lab testing that I use in my clinical practice. And of course, if you're looking for additional help, please feel free to email me to inquire about getting either additional private help, or if I'm not a good fit for you, I can also potentially connect you with someone who is. And if you have a question you'd love to get answered, remember, head on over to healthyskinshow.com, scroll down to the bottom. That way you can find our voicemail box where you can leave us a question that you'd love to have answered on the show. All right, I would love to continue talking about this, but I'm sure those of you who have been dealing and suffering with adult acne would prefer to probably dive into the next conversation with my guest. She's one of my go-to sources on hormonal issues, and frankly, she's also a really awesome person. So let's jump into that conversation.
Hello, everyone, and welcome back to the Natural Skin Show. I want to welcome a guest who, for those of you who tuned in to the Eczema and Psoriasis Awareness Week, you know my guest. She had one of the best, and honestly, oh gosh, I felt like all of the talks were eye-opening, but hers was particularly eye-opening in terms of hormonal issues. So we're going to dive deep today into some hormone issues and how that's connected to the skin. Brie Weisselman is a digestive health and hormone balance specialist working with women around the world in her online practice. Besides women's health, Brie specializes in helping people with digestive problems such as IBS, parasitic infections, candida overgrowth, and SIBO to rebuild a bulletproof microbiome. Using her programs that integrate functional and Chinese medicine approaches, she's worked with hundreds of clients living all around the world, Dubai to New Zealand to California, empowering them with the personalized roadmap for understanding and transforming their health. Thank you for joining us, Brie.
Thanks for having me. I'm happy to be here.
I know. This is like our second time doing this, and it's super exciting.
It is. I know. I love what you're doing. We were just chatting for a moment. I love your mission and the vision and really getting this awareness out there, because I think it's an area that there's a lot of room for improvement, a lot of room for getting the info out. So thanks for doing that.
I know. And you know what? Your topic today that we're going to talk about really jumped out at me. And so a lot of adults struggle with acne, right? So you've gotten acne, you didn't have it. So why don't you set the stage? Because I feel like you could do a better job than me. Tell us, what's the deal? Who are we talking about so they know, like, if you're talking about them or not?
Absolutely. Okay, so right now and today, I'm talking about women with acne, and this could be any age woman with acne. So it really could be applied to somebody in her teen years, But this becomes more obvious, this scenario I'm going to talk about, when it's acne that showed up either a little bit later in life or that persisted after the teen years, despite treatment.
So like, why do I have acne? Why does my skin, I'm an adult. Why do I have acne?
Exactly. I have so many clients who have this situation and they're just like, seriously, what gives? I thought that was supposed, at least I wasn't supposed to have to still deal with that, right? And I love talking about this because it was exactly my story. So you wouldn't know necessarily by looking at my skin now, but I had a good 15 years of adult acne issues. And the funny thing was I had like perfectly crystal clear skin as a teen, while all my friends were going through the rigmarole and, getting treatment, going to dermatologists. I was like, I don't think I've ever had a pimple. And then I hit 20 years old. I think it was like my birthday. And all of a sudden, I just started breaking out all over my jawline and my chin. And it was horrible and like cystic and persistent. And then little tiny irritated spots that would stay for weeks. It took me years to figure out what was going on. So I love telling people about this because it's kind of like this big overlooked possible cause if you have that going on.
Well, I think a lot of times people assume, well, first of all, is it a food issue? That sort of seems to be like the next most natural step that people go to. But a lot of times when it's a chronic issue, like you and I have talked about a lot of chronic skin issues, there tends to be something underneath that is not clear to you, the sufferer, of what's going on. So in the case of adult acne, what is this one like kind of hidden, I guess, condition that you have discovered a lot of people suffer with, but they have no idea they have it?
Yeah. So the situation is a syndrome called polycystic ovarian syndrome. And I'll talk in a minute about exactly what that is and how we define it. But I think what would be better is for me to kind of paint a picture of who this is.
Yeah, please.
So commonly what happens, and this is exactly what happened to me, is this woman got her period a little bit later in her teens, if she got it at all. Maybe it never showed up. Or her period started on time, but then most women's periods when they first get them are a little irregular, like maybe they skip a month here or there, but usually within 6 months to a year, that kind of straightens itself out and they develop a regular monthly cycle. A lot of women with PCOS just never really get that regularity, or they have longer windows in between. Like I used to go 3 to 6 months between getting a period for a very long time, the first 10 years that I had a period. And then what happens is acne starts to develop and hair growth in places that you don't want it, like nipples or your lip or your chin, maybe on your stomach. And so then this woman goes looking for solutions. And often what's given to her is she's put on birth control pills, usually first to regulate her period and help deal with the acne. And sometimes offered antibiotics like tetracycline or drugs like Accutane to also suppress and control the acne. And I get it, when you're young and if that's the options that are offered to you, those are the first tools offered to you, you're just like, I don't care, just get rid of this, because it's really putting a damper on your life to walk around with acne all the time. So the unfortunate thing is that these drugs, man, if I was telling you, if I had $1 for every time that I had a client that's later on working on gut issues in their 20s, 30s, 40s, 50s, who, had that exact story of those drugs, I wouldn't have to practice. No, I'm joking. But it's like adding insult to injury because these are all known to damage the microbiome and promote yeast and fungal overgrowth and dysbiosis in general, which just sets the stage for more inflammation, more acne, and other health problems down the line. And women with polycystic ovarian syndrome actually have a less diverse microbiome already. We can work on it, but innately it's less diverse in studies. And that's really important.
Well, I was going to say, for somebody who's listening to this and they're like, polycystic ovarians, like I didn't even know I had a problem with my ovaries. They're just there.
Absolutely.
What is that?
Yeah, what is it? So it's defined as it's the most common hormone and metabolism imbalance that exists. It affects 1 out of 10 women. And it's an imbalance of our reproductive hormones, testosterone, estrogen, and progesterone, that creates a problem with how our ovaries function. So it makes it so that the egg that normally develops each month that we ovulate may not develop fully, or it might not be released during ovulation. So we think of polycystic ovarian syndrome as an ovulation problem, but it's so much more than that. So the take home is that this is a whole body metabolic issue with multi-system involvement and not just a skin thing or not just a reproductive thing. So the clinical picture, what we look for is that this person is going to have what we call androgen excess. Androgens are like our testosterone or DHEA or hormonal metabolites downstream from those. And this can look like that excess hair growth that I mentioned, or male pattern hair loss or hair thinning, acne, having like a short temper or mood swings, or easy to get stressed out or irritable, a poor stress response, and actually being more prone to depression. And then coupled with that, we look for ovulatory issues. And signs of this would be someone who's not ovulating, like they're maybe having long, irregular cycles or have a missing period. And in the later years, this can lead to fertility challenges. So in fact, it's the most common cause of female subfertility and infertility is PCOS.
Wow.
And if you look on an ultrasound, often, but not always, you'll see multiple cyst-like follicles. It looks like a ring of pearls, it's been said, on the ovaries on imaging. Now, this is all related to insulin signaling in the body and blood sugar balance. And so some of that is genetic. And people with PCOS, those of us with this, are born just more susceptible to developing less sensitivity to our insulin. And that will drive this problem. And that can be managed with diet, lifestyle, nutrition, and other therapeutic steps once you know it's happening. But before it's happening, it can just look like this kind of bunch of symptoms that's showing up in someone. In a lot of people, they could start to gain weight around their middle or struggle to keep their weight down despite having a good diet or regular exercise. But there's a whole bunch of women, in fact, like over 50%, who are what we call thin types, meaning they're normal weight or underweight even. So there's a misconception with PCOS. Stereotypically, when we initially started to understand what this was, it was women who were overweight or obese and had, hair growth like the bearded woman at, in the circus, and missing periods or irregular periods. That was like the picture. But we now understand that this affects so many more women, and to varying degrees.
And so for someone who's like, all right, first of all, I've got this acne, which, oh my gosh, this is awful. And it's embarrassing. There's a lot of shame around, not being able to cover it up, especially when it's cystic and it's painful and your skin just does not look smooth. But then also you have this flip side of where we live in a society now where it's like, remove all the hair that you possibly could have. So if you then have had hair removal, like, I think that's actually important, because if you've had hair removed in these areas, that may have been a sign of something rather than, oh, it's just an annoyance. Like your body's just like doing what it wants to do. It's actually trying to tell you there's a hormonal problem underneath the surface that's driving these symptoms, essentially. I think that's an important point, is that how many times you go to the dermatologist? Gosh, I went to the dermatologist a lot as a teenager and as an adult, unfortunately. And they just look at your skin and go, oh, here's some cream, try this pill. Like, they don't really look any deeper. And what we're talking about is blood sugar. We're talking about hormone balance. Like,
absolutely. No, we have to be our own advocates here. This is why I like talking about this a lot. Like what you just said, that's like one of my pet peeves, or one of my issues with our system, is that, so what happens is, what happens? You go, oh, I have acne, I want help. You go to your doctor. Maybe they refer you to a dermatologist. The dermatologist is going to give you drugs, right? They're not referring you out to a gynecologist to look at if you have a reproductive syndrome. And even if you are talking to your gynecologist about it, I would say nowadays more so, some gynecologists are at least aware of this and will kind of think about it. But often, even if they're helping a younger woman or even a more mature woman diagnose polycystic ovarian syndrome, usually the only tools that they have to offer the person is, let's put you on birth control to, quote, regulate your period, which we all know doesn't actually regulate anything. It just creates a withdrawal bleed and suppresses your hormones. Or if it's a woman of reproductive age who's trying to get pregnant, then it's like down the line of Clomid and in vitro, and how can we get you to achieve pregnancy, wrangle your body into that. So no one's looking at the big picture and educating their patients and saying, hey, you have this condition, here's what it means to live with it, and here's how to keep yourself healthy over your whole life. Because the acne and or tendency to gain weight or having to work harder to keep that balance is one thing, and that's frustrating. But there are ramifications that have to do with bone health and cardiovascular health and brain health over the woman's whole life, even, when she's in menopause. And those are the things that doing this lifestyle stuff can really help women maintain their health.
So if somebody is going to go to the doctors, maybe they go to their PCP or their GP and they're like, hey, like me, I'm the jerky patient that shows up with this list of blood labs that I want my doctor to run. Thank God my doctor loves me, but what are some things that maybe they could go to their doctor with that are like super easy to ask for, that maybe their insurance might pay for, that would at least start hinting toward there being a problem, so maybe they can at least get some clues, and then maybe you have some more advanced testing suggestions or something like that that would be helpful?
Absolutely. Yeah. So there's a couple of like the simplest labs, and then there's a whole set, because I was that girl too. Like, hey, can I run this? Can I run that? Until I could run my own labs. So one of the most clear signs, although I will say this isn't present 100% of the time, is if you run two hormones that are commonly run in women, one that's called LH, luteinizing hormone, and the other one that's called FSH, or follicular stimulating hormone. Those are hormones that help regulate our menstrual cycle. And they're often run when you do a hormone workup on a woman. So they're really easy to get. And if you run those, they should have a pretty balanced ratio, like 1-to-1 ish, something like that. But if the ratio is between 2-to-1 and closer to 3-to-1 of LH to FSH, that's a big suggestion that somebody is dealing with PCOS. And then they can go to look deeper. The other thing I look at is I'll look at, fasting glucose, but more importantly, fasting insulin, because you might have normal glucose levels, but a imbalanced or overblown insulin response. And so there's actually a particular ratio we can look at between those numbers, but ultimately we're just looking for that fasting insulin. We want it to be 5 or lower, ideally. So if it's creeping up, then that can be a suggestion. And then also, of course, I actually kind of overlook the more obvious ones, is just running estrogen, progesterone, and testosterone. So those are other hormones that would be part of a basic hormone workup, like the LH and FSH. You might see in somebody elevated testosterone or elevated, there's another androgen or male hormone called DHEA, and that can be commonly elevated also. So if you see elevated testosterone or DHEA, and oftentimes you'll see elevated estrogen and low progesterone. So that's a pattern that's very suggestive.
Interesting. And this is stuff you can actually go to your regular doctor. And if you can, again, this is why there's a danger of saying, oh, my symptoms are all separate. Mm-hmm. They're all one picture. They're all one constellation. And if you, as the patient, don't put them together and present them as a picture to your doctor, if you're just like, I'm just here for my skin, mm-hmm. you have all these other issues going on, it's hard for them to even be able to justify running these labs. But when you sit down and you really write out all the symptoms that you have going on systemically, so as a whole throughout your body, all of a sudden they might go, maybe I do have cause to write for these labs, and your insurance will at least pay for it and give you some, this is a good starting point. So if we go on to mm-hmm. things that are more, like if we were to dive a little bit deeper, what are some other labs that, real quick, that you might use?
Yeah, so those ones I mentioned are ones that you're going to ask any doctor, and they're probably not going to argue with you about it. And then there's a couple that are like, we have to have a good reason to run that, right? So one of them is called AMH, Anti-Mullerian Hormone. That's a hormone that's usually only run when a woman is in her 30s to 40s and is looking to check on her ovarian reserve, meaning how fertile her eggs are at this point, how much fertility she has left. So it's a pretty accurate marker. But in women with PCOS, what happens is that because they have more of the follicles that are waiting to ripen, this number disproportionately represents this. It's not a true marker of reserve in the sense of remaining fertility. It's just the number is going to be larger because there's more follicles hanging out. So that number is ideally dependent on age. So if you're under 33 years old, then the AMH might be as high as 6.8 and still be considered normal. So if you have someone who has it at like 8, 9, 10, that's going to be suggestive of polycystic ovarian syndrome. But by the time you're like age 35 or 40, all women's AMH will have gone down relative to what it was in their 20s. And so then the more common range that we see would be between 1.3 and 3.5. So when it's more like 4, 5, 6, that's when, you're kind of thinking, okay, maybe this is a PCOS picture.
Interesting. So Brie, I think that at this point, knowing how much more we have to talk about, I think we should do a part 2 of this interview. That's my feeling here, because I feel like we just have so much more to unpack, because this is a big embarrassing point for women, and it's a big topic. So if you're down, I want to have you come back. First off, everybody, so Brie is amazing. I really love her, and she just knows so much about hormonal stuff. That's why I know Brie has a gift for you guys. She's got this great hormone balance quiz that you can take for free to kind of give you an idea of what's going on. Now, Brie, how can they go take that? Because I think everybody's listening to this going, oh gosh, I've got to go ask for labs, but this might be a first good step in the right direction.
Absolutely. It's a great way to just get a general sense of if you have an imbalance of any of these hormones we were just talking about. And it'll kind of point you in the direction of which ones might be out of balance. So that exists on my website, on the homepage, and actually on the Get Help with Hormones page. And I think I can also give you the link, and maybe we can post it in the notes.
Yes, absolutely. We will have a link for you guys. If you come over and check out the post for this podcast, we will have all the show notes. Brie's linked everything. Again, she is awesome. I really feel lucky that A, I have met her, B, that I've had the pleasure of working with her a couple of times. She's super great. And I hope that, she'll be an asset to you just as she has been to me. And she's a great resource for this kind of stuff, because the hormonal component of skin issues is pretty complex. It's not simple, and you have to really understand hormones. That's been my experience. If you don't really know hormones, you should find somebody who does, or say, hey, I appreciate your help, but I need to find another practitioner that really understands this balance, because you can mess things up when you screw with your own hormones and don't know what you're doing. So
definitely,
we can see when the body is not happy hormonally, not so pleasant things happen. So Brie, let us continue this conversation, but thank you for joining us, and I can't wait for the next little chat. We're going to continue this.
Thanks for having me. I can't wait to come back.
Don't forget, everything that Brie and I talked about is going to be in today's post show notes for this particular episode, okay? So you won't miss anything, especially any of the recommendations that she shared. And I have a special treat for you. Brie is definitely going to be back. We actually have another episode coming your way, so stay tuned. Thank you guys so much for tuning in. I really appreciate it. Don't forget to subscribe to the podcast. That way you don't miss any episodes. And if you haven't left a review yet, head on over to iTunes and share what you find valuable, eye-opening, surprising, and just all around encouraging, so that others in our community can get connected with this incredible information. All right, I hope you have a good rest of your day. I look forward to seeing you in the next episode so that we can continue to work together toward helping you rebuild healthier skin.